Here we now come to the second part of eponyms, signs, names and syndromes in ENT. Erysipelas, also known as red skin or St. Anthony's fire, is an acute streptococcal bacterial infection of the deep dermis with lymphatic spread. In millions year sign, erysipelas can spread to pinna, whereas cellulitis cannot. Cellulitis and erysipelas manifest as areas of skin erythema, edema, and warmth in the absence of underlying suppurative foci. They differ in that erysipelas involves the upper dermis and superficial lymphatics, whereas cellulitis involves the deeper dermis and subcutaneous fat. As a result, erysipelas has more distinctive anatomic features than cellulitis. Erysipelas lesions are raised above the level of the surrounding skin, and there is a clear line of demarcation between involved and uninvolved tissue. Classic symptoms of erysipelas note a butterfly involvement of the face. Involvement of the ear, which is called the millions ear sign, is a distinguishing feature for erysipelas since this region does not contain deeper dermis tissue. Omega sign. This is seen in laryngomalacia, where the infantile omega-shaped epiglottis manifest. Here is a picture of the omega sign, where the epiglottis has become omega-shaped in a case of infantile laryngomalacia. The Paul Dudley White winking earlobe sign. This is seen in tricuspid insufficiency, wherein there is movement of the earlobe coincident with the pulse, suggestive of tricuspid insufficiency. Bigger's sign. Bigger sign refers to tinnitus with dizziness and vertigo that improves at high altitude, such as in an airplane, and this is suggestive of Meniere's disease, called the Bigger's sign. Phelps sign. This refers to loss of crescent of bone as seen in a CT scan between the carotid canal and the jugular canal in glomus jugulare. Chopstick's sign. Chopstick's sign is a contraction of muscles of the eye, mouth or nose elicited by tapping along the course of the facial nerve. This was first described by František Chopstick, a Czech Austrian physician in 1876, and later independently by Nathan Wyers in 1883, also therefore known as the Wyers sign. Stand in front of the patient and begin by telling him to relax his facial muscles. Tap the facial nerve either just anterior to the earlobe or below the zygomatic arch, or between the zygomatic arch and the corner of the mouth. A positive response varies from twitching of the lip at the corner of the mouth to spasm of all facial muscles, depending on the severity of hypocalcemia. Chopstick sign may also be present in hypomagnesemia, frequently seen in alcoholics, persons with diarrhea, persons taking aminoglycosides or diuretics, because hypomagnesemia can cause hypocalcemia. This sign usually suggests hypocalcemia but can also occur in 25% of patients. Typically, it precedes other signs of hypocalcemia and persists until the onset of tetany. It can't be elicited during tetany because of strong muscular contractions. Normally, eliciting Chopstick sign is attempted only in patients with suspected hypocalcemic disorders. However, because the parathyroid gland regulates calcium balance, Chopstick sign may also be tested in patients before neck surgery to obtain a baseline. The rat tail sign, also called the bird beak sign. This is a sign in barium swallow of achalasia cardia. The esophagus is dilated and contrast material passes slowly into the stomach as the sphincter opens intermittently. The distal esophagus has a narrow segment and the image resembles a rat tail or a bird's beak. This is a picture showing the rat tail appearance in achalasia cardia. However, this is in contrast to the rat tail appearance of carcinoma esophagus. Here, barium swallow shows the characteristic rat tail appearance, but with irregular mucosal margins in carcinoma esophagus. The rising sun sign. This is a red vascular hue seen behind the intact tympanic membrane. It is seen in glomus tumors, high jugular bulb, and an aberrant carotid artery in the floor of the middle ear, and this is the rising sun sign, usually seen behind the intact tympanic membrane, a red vascular hue. Raccoon sign. This is the purplish discoloration around the eyes following fracture of the frontal portion of the skull base. It is so called because raccoons have this feature of a purplish discoloration around the eyes. Raccoon's eyes indicates subgaleal hemorrhage and therefore not necessarily base of skull. It is usually easy to differentiate raccoon eyes from the black eye associated with facial trauma. Raccoon eyes are always bilateral. They develop 2 to 3 days after a closed head injury that results in a basilar skull fracture. In contrast, the peri-orbital ecchymosis that occurs with facial trauma can affect one eye or both. It usually develops within hours of injury. That is, the peri-orbital ecchymosis as a consequence of trauma develops within hours of injury, whereas raccoon eyes develop 2 to 3 days after a closed head injury. Schwartz sign. It is also called Flamingo Flush or the Flamingo Pink Blush. This is seen because of increased vascularity in the submucous layer of the promontory in an active phase of autosclerosis. And this is the Flamingo Pink Blush seen through the drum on the promontory. Steeple sign. This is an X-ray finding in acute laryngotracheobronchitis, also called CRU. The steeple sign is produced by the presence of edema in the trachea, which results in elevation of the tracheal mucosa and loss of the normal shouldering, which is the lateral convexities of the air column. This is a normal picture of the anteroposterior radiograph of the upper airway with the normal appearance of the subglottic region. And when there is laryngotracheobronchitis, this is the picture of an anteroposterior radiograph in a patient with CRU. The subglottic tracheal narrowing produces an inverted V appearance known as the steeple sign. The Stankiewicz sign. This refers to fat protrusion into the nasal cavity on compression of the eyeball from the outside, and this indicates orbital injury during FES, described by James Stankiewicz, professor and chair of the Loyola University Chicago School of Medicine. The teardrop sign. This is seen in orbital floor fractures. It is defined as a teardrop shaped opacification seen hanging from the roof of the maxillary sinus on a water's view. The floor of the orbit is most common portion of the orbit to sustain a fracture. A classic radiographic finding in blowout fractures is the presence of a polypoidal mass protruding from the floor of the orbit into the maxillary antrum. The teardrop represents the herniated orbital contents, periorbital fat, and inferior rectus muscle. This X-ray shows the classic teardrop sign seen in a blowout fracture of the inferior orbital wall. Thumb sign. It is a thumb-like impression seen on an X-ray lateral view neck due to enlarged epiglottis in acute epiglottitis. Direct visualization of the epiglottis by a laryngoscope, if attempted at this stage, would reveal a beefy red edematous epiglottis. This X-ray shows the classic thumb sign due to an enlarged epiglottis in acute epiglottitis. Teapot sign. This is seen in CSF rhinorrhea, and it could be related to the relationship of the sphenoid ostium to the sinus floor. The sphenoid ostium lies at an appreciable distance anterosuperior from the sinus floor. An increase in CSF rhinorrhea therefore occurs in a case of sphenoid sinus leak when the patient bends forward as an increasing amount of CSF gains access to the ostium in the classic teapot sign. Here we see this patient bending forward and CSF dripping from the nose like a classic teapot. The uvula pointing sign. The uvula points to the side of palatal palsy, and when that happens, it is called the uvula pointing sign. It is also seen in rhinoscleroma, and this happens when the scleroma involves the nasopharynx, wherein the uvula points towards the roof of the nasopharynx. Wood sign. This refers to palpable jugulodigastric lymph nodes.